Hello everyone, I am Dr. Rudrajit Sinha. Now the India Autism Center has called me up again for doing this Ask Me Anything series, which they give random questions coming from the respondents and I will have to answer them to the best of my ability. This puts me in a spot. So people who don't know me, I am a surgeon and I have subspecialized in gastroenterology. I'm also the father of a 16-year-old boy in autism. So that makes me an expert in two fields. See, one of the first most frequent concerns that I hear from parents and caregivers from this field is gut issues or gastrointestinal issues, which can be varied. It can be from the upper GI, stomach-related thing, or it can be from, the colon and rectum related things. So these are some subtle differences, and I'll try to answer these questions to the best of my abilities, right? So here goes. The first question that I got is, do gut problems make my child's autism symptoms worse? So actually gut problems makes everyone's symptoms worse. It is not specifically autism related thing, but yes, there are some things which we will have to know about autism and about gut issues. So regarding autism thing is that they have, as you know, a problem in communicating. Most or some are non-verbal and they cannot tell at the time when they're having pain or bloating or they're feeling heaviness in the abdomen. So that comes out through maybe a behavior, that comes out through maybe agitated episode. So the parent and the caregiver has to be very careful about what is that person trying to convey. It is a difficult thing, but as you are the first responders, the parent and the caregiver, you should know when the child is having a real issue with the gut or whether it's just a behavior. So that distinction is very difficult to make. The second thing is the child not only has difficulty in communicating, but also their awareness of internal processes in the body is hampered. In the sense that, for example, if I have a pain in the abdomen or one part of the abdomen, I'll be able to say, see, I have a lower right side pain in the abdomen, or I can just point. The thing with autism is that it's very difficult for them to understand where exactly the pain is coming for, if at all a pain is there. So all these things makes the entire situation for the poor child very difficult. So as parent and caregiver or anyone who is seeing an autistic individual, you'll have to keep this in mind because the communication is not that clear, and also exactly where the child is pointing or if at all pointing is something which you'll have to keep in mind. Gut problems, when it's there with the child, how will you know that it's a gut problem and it's something else? It's very difficult for you to know, but what I can tell you is that if you observe the child over the course of his life or over the course of years, suddenly if you see a change in behavior and you can link it to something he ate or maybe he hasn't gone to the toilet for 2-3 days, you will have an idea that is coming from the gut. If some child who can point, that's fantastic, but there are some children who cannot even point. So you'll have to be just aware of what the child is having, whether you have left him with someone else's house for a few days. These things are very important for you to know. And as a doctor also, these are the questions I ask by all my patients. Okay, the next question is, how can I tell if my child's irritability or meltdowns are linked to gut pain? Yeah, I've answered this before, but I'll be a little bit more specific over here. It is very important for you as parent and as caregiver to understand what is the baseline for your child, right? What is the baseline behavior of your child? See, everyone's children in autism is different. So your things might not match with another parent. But what you have to know is that whether it is matching the child's previous behavior or not. So if you have a baseline behavior that is happening, you suddenly see the child has developed self-harming behaviors, or the child is banging his head, or the child is not being able to sleep well. Since gut problems are very common in our country, you will have to understand that there might be a gut issue over here. Also, a lot of gut issues with this very underreported thing comes with hygiene. Normally, these children or these adults with autism, they don't have that concept of self-hygiene, of washing hands, of not putting certain things in the mouth. So they might be itching somewhere and they put that in their mouth. So through that some infection might come into the gut. So you'll have to be aware of that as well. If your child is suddenly there's a change in behavior, suddenly something is happening, you'll have to think that okay, fine, there's some kind of physical issue that is happening with him. You have to rule out a gut issue, you have to rule out things which are hidden. Now, it can be an earache also, it can be a dental toothache also, it can be difficulty in micturition, like difficulty in passing urine. So all these things you'll have to keep in mind, and you have to do a regular checkup for your child. It is always better to have one kind of doctor who is with the child since the child is growing up. Normally, previously we used to have this family doctor concept who used to see all our children growing up. It's connected to your family for years. There's a certain number of trust that happens. So it is very important for autistic families and caregivers to expose your child to that particular doctor as frequently as possible. So the doctor also knows, that when the child acts like this, this is what is happening. So the irritability and meltdown, you'll have to be careful that whether there's any physical discomfort the child is facing or not. And if it's a physical discomfort, and if you see that, with little medication like, maybe with an antacid or something that's not going, you take him to the doctors. Don't try to self-diagnose, because what happens is that you will make a mild situation worse. And all these disease processes gives you some time to, treat it with medicines or diet. Before that it becomes a surgical emergency. The third question which I see is that, can changing my child's diet really improve their behavior or sleep? So this linked to the kind of diet your child is having. Normally the children in the spectrum, they have a very specific kind of food they like. You'll have to make sure that the child from a very young age has a very balanced home cooked food. You have to avoid having outside food or avoid having these apps which bring outside food to your home. I know it is very difficult in this age because the parents also is very, very tired to even cook foods every day. But this something is very important, especially for young children who are growing up. So this habit has to come in your, at a very young age, 5 to 6 years age. You have to make sure that the child is having balanced food or not. Now what happens is that sometimes we take him to a outside restaurant or something like that, and suddenly the first thing that issue that the child has a troubled stomach is that on that day or the day after the child is not sleeping well. Because normally when we have a disturbed stomach, our sleep gets disturbed as well. So it is very important for you to have a review of what your child is having. Keep a food diary for a particular amount of time and see that what food items is giving him bloated stomach and what food items you're okay with it. After that, you have that information, you can take him to a dietitian, you can take him to a doctor who is going to modify his diet. Also make sure that he has adequate amount of vitamins, micro minerals, protein and carbohydrate and fat. So it is very important to have balanced diet. The cheat code over here is to remember what we used to have when your grandmother used to cook or grandmother or grandparents used to cook in that household. You try and introduce that kind of food to your family. It will be good for you as well as the child. So make sure that your child is having a balanced diet, and then you will find that the child has a good sleep. And if he has a good sleep, you'll find a lot of behaviors and a lot of symptoms which it stays controlled. So another question is, why does my child struggle so much with stomach problems? See, this is quite a difficult question, because we have seen that in autism their hygiene is not that well. So they tend to put everything in their mouth, or they don't wash. So one of the commonest way of having gastrointestinal infection comes through the mouth with not hand washing. So hand washing is very, very important. Make sure that you develop this habit. See, the reason I'm telling you all these things is that these actually cost nothing. So if you can inculcate this habit of washing your hands, even if the person doesn't know about the soap concept, just make sure he can open the tap and wash his hands. So with that, that wash itself can sweep away 95% of the bacteria that might be residing in the palm or in the nails. Make sure that all the nails are cut, so under the nails all this dirt is not there. The other issue with the children with autism is that, as I told you, they don't have this concept of interoception. That is that they don't know exactly where in the body, where in the stomach they're having their pain. The third issue is that we have this good bacteria that helps us digest a lot of things. Since their intake of diet is so limited, narrow, and they don't have a balanced diet. Also, there are a lot of infection that go in. These bacteria tend to move, the lower GI bacteria tend to move up. the upper GI bacteria tend to move down. So that becomes all bloating, and this is something which is very, very important for you to maintain. So good hygiene is very important for stomach issues. You make sure that there's no translocation of bacteria that goes from here to there. So that can be avoided by regular meals, regular sleep. The child is less anxious, and also balanced diet and hand washing. So these kind of things, these 5 things are very, very important. So the next question they ask you is that, are probiotics actually safe and useful for autistic children? So let me tell you what probiotics is. Probiotics is a sort of a bacteria that we have in a capsule format, which replenishes the normal bacteria that we lines in our gut, which helps in our digestion. So sometimes, why do we have it? Sometimes these bacteria, when we have anxiety, or when we have not sleep well, when we have a gastrointestinal infection with other bad bacteria, or when we have an antibiotic course, for example, which kills all bacteria, it gets exterminated. So when that happens, we lose the ability to digest a lot of things which these normal good bacteria helps us digest. When so that comes out as a bloating, that comes out as a pain abdomen. So when we do a course of probiotics, the probiotics helps us replenish those bacteria, and it goes back to our normal self. So we can digest well, we have a sense of good feeling, because again the mind-gut connection, and it generally helps us to be healthy. Now it is very safe, provided you take it from a good company, and it is actually, I won't say useful, but it is a good addendum in the armamentarium of the food thing which is there for autistic children, because sometimes we cannot really control their hand washing or kind of infection coming in. So you can do a probiotic course once a year, which is very good. So, but always consult with your doctor or the dietitian, who will know exactly what kind of probiotics to give you. So it is really good, it is safe, and it is a good thing to have in our, as in a doctor's armamentarium. Another question which comes, when should I take my child to a doctor for gut-related issues? This is actually a very difficult question. The reason I'm telling you this as a doctor and as a parent is that, see, all children with autistic are different. So their manifestations of a lot of their behavior is different. Some people some autistic children who can verbal, who can tell you exactly, yeah, I have a stomach ache, or I have a stomach ache, the same ache I had 6 months ago. So that is a general thing. But there are many of autistic children who are non-verbal and who cannot even understand that they have stomach issues. So that comes out as behaviors or something. Of course, it is very important for parents to know what your child's behavior is, and if there's a sudden change in behavior. Also, your doctor, that family physician who is there, he will also know exactly if you take him, that he has seen the child before and he does this when he has a stomach issue, so he can give you a probiotic, or even give an antibiotic if it's required, or he can elevate it to a second gastrointestinal enterologist specialist. So it is very important to know your child, how he's communicating, and what is, not all communications are verbal, so that you can, when you take him to a specialist doctor who has not seen your child, you can tell the doctor, normally the last time he has done this, he had got a stomach issue. The doctor, for his part, if the doctor is not attuned to how autism children are, it might be a little bit difficult for him. So from a doctor to another doctor, I can tell you is that, you'll have to give it time. You'll have to take what the parents are saying very seriously. And sometimes, the child might not give you classical symptoms of, GI, ache. So what you need to do is that if you can find out what the diagnosis is, fine. Maybe you can do a scan, ultrasound scan, to rule out the more serious things like an appendicitis or some other issues. So it is very important for parents, caregivers and doctors to understand gut-related issues in autism. It is a bit of a challenge for all, but over the course of time and with some experience, we all get better. That brings us to the end of the session in today's conversation. I hope I could have give you some understanding of the connection between the gut health and autism and how people are generally. You have to understand that gut-mind connection, the mind-gut connection, is something which is still evolving, and we are having increasingly over the course of time, we're having more and more evidences that it is connected in some way. The mind is actually the communication device of all gut-related issues. So wherever someone is having a difficult day or wherever someone is having a behavior which is not normal, you'll have to understand that there's some other things that is happening. So with that, we come to the end, and I would like to thank India Autism Center for having me again. And I wish you all the best. Remember, the 5 things that I've told you about autism is that make sure that the hands are clean, make sure he's having good food, make sure there's enough exercises, and make sure there's good sleep. And the 5th thing is make sure that you love your child and there is a good communication, be it non-verbal as well, between your child and yourself. So thanks a lot.